Hi, we're Nia and Marianne from Seren Health Coaching. We are metabolic health coaches who are passionate about good metabolic health for everyone. We also love to chat about all things health and to share as much information as we can with people who want to make changes to their lifestyle but aren't quite sure where to start. We're going to release a new episode every Friday where we talk about a different aspect of health. So do subscribe and let us know what you think. We'd also love to know what you're interested in too. So if there's something that you'd like us to have a chat about, do send us a message and we'll do our best to cover it soon. Hello, Marianne.
Hi, Nia.
How are you today?
I'm all right, and I'm going to talk about something that I love talking about.
Oh, well, unfortunately, that's not very helpful because you love talking about lots of things. So what specific thing are we doing
Oh,
today?
we're going to talk about reversing type 2 diabetes and, how this is such an important part of my story, but um, just how it came about, I think. It was a
Cool.
real turning point for me when I realized it might even be possible to reverse type 2 diabetes. I worked in general practice for many years, as you know, and towards the end of my career, I inherited looking after patients with diabetes.
Were
I
you
did.
jumping up and down to take on diabetes?
Oh golly, I definitely wasn't. I tried to wiggle any way I could to not get the job.
Mm,
But somebody went on maternity leave, and basically it was mine. So initially, I really, really didn't want to do it. I went and did some training, and of course, when you when you know more about things, you often get more interested. So I did
mm,
become more interested. But the reason I think it wasn't a very popular slot in general practice at the time, and I'm sure I wasn't alone, was that it was a progressive chronic disease and was
mm.
seen as something that happened to the elderly, by the way, when a long time back. And it was quite depressing, really, for both parties. So no one was madly enthusiastic about managing this metabolic
Yeah.
disease. I think that's where we were.
Okay. So what were the patients like when you first started looking after them? How did they feel about their diagnosis?
Yes, I mean, understandably, very depressed mostly,
Mm,
and often quite depressed initially at diagnosis, because it's
mm.
quite a big diagnosis to give somebody. I mean, a long time back, I mean, hard to remember now, it was often referred to as diabetes of the elderly. And
Yeah, yeah.
it wasn't given much credence, actually, because it was considered that if you got it really old, that you weren't necessarily going to develop the complications which diabetes is all about in a way.
Yes, yeah.
So I suppose the main aim then was just to get blood sugars down.
Yeah.
Um, we used to start medication, and this was lifelong medication, really fast. So that
Yeah.
was pretty depressing for somebody to be told that they had a chronic disease and that they were going to have to take medication for the rest of their life. And actually, at diagnosis, we often told them at this point that they would be on insulin in 2 years. That
Mm.
wasn't necessarily the elderly.
That's
Um,
just anybody. Yeah.
yeah, just anybody. Because by the time I started looking after diabetics, they were getting younger. So
Yeah.
there was already a drift.
Yeah.
Okay.
Okay, so it was all medication first. So there was no sort of waiting to see if we could change their lifestyle and if that would make any difference to them.
No, I think I think there was a general odd feeling. This now, when I
Mm.
look back, that people's lifestyles were their own private business, and
Okay.
although we ticked a box on lifestyle, I don't think we really believed, nor did they,
That it
that
would actually do
lifestyle
anything.
was really that important.
Yeah, so I
So,
remember back then when patients were coming to you in the pharmacy and they would say, "Oh, by the way, I want to buy." When you have to ask them questions when they buy
mm,
over the counter medication, and a lot of the time we'd say, "Are you diabetic?" for particular drugs,
yeah,
um, and then they would say yes or no, and then you'd say, "Are you diet controlled or medication controlled?"
yes,
So that was a
yes.
thing that we had to ask, and then there was just a time when we just stopped asking because nobody was diet controlled.
That's interesting. So, when I first did that training, I think there was a real There was a real thing about getting people on medication really fast. And I can
Right.
see why, because
Yeah.
the complications were caused by high blood sugars. So we didn't think further than that, and nor did we know further than that, actually. So this is my story. This is where it gets more exciting.
Yeah. Okay. So at the time, we thought
Yeah.
that the problem was that we weren't getting enough insulin, so that was declining insulin levels that caused blood sugars to
Yes,
rise. All
exactly.
medication that anyone was ever given was aimed at increasing insulin
Yes,
levels
yes.
to decrease your blood sugar. Um, Often the first drug of choice was actually probably my favorite and
Yeah,
yours.
the only
Um,
drug that you really wanted to have,
yeah,
actually.
which is
Yeah,
metformin, but
yeah.
unfortunately, we often gave it in huge cracking
Yes,
doses that
yes.
give everybody rather unfortunate
Terrible
digestive issues.
digestive side effects. Yeah, and a lot of my patients would never take it again. Yeah.
I completely understand that. I'm with them.
Yeah,
So,
yeah.
yeah, and then of course we had to add the next group of medications. Then unfortunately, they
Yes.
just weren't as good in terms of
No.
more side effects and more problems.
Well, the next group of medications were to do with bringing that blood sugar down rather than anything to do with insulin
Mm,
sensitivities that we didn't really understand at the time anyway. But then, you've got a whole different ball game because those medications made people put on weight. And we didn't
yes.
really understand that at the beginning when I first got involved. Patients used to say, "But why are you giving me drugs that make me hungry and put on weight?" And I have to say, I couldn't really work it out. And this is where the question marks began.
We look back now, don't we, and we think, well, of course, now we know that
Yeah,
that by making them more hungry, we were making them put on more weight. We were actually doing them a disservice because their diabetes
we
was getting
were.
worse. But we didn't
We
know that
were.
then.
No. But I do remember thinking it was incredibly unfair. And
Mm,
I did believe them. And I think quite a lot of my colleagues probably didn't
no, no,
believe
no.
that they
Yeah.
were made hungry by the medication. Um,
And then, of course, these drugs, these medications, they
yeah.
also caused hypoglycemia, which is a
Yes.
low blood sugar.
Yes.
And that's terrifying if you've ever experienced that. So people,
Absolutely terrifying. So a lot of patients then ate little and often to try and avoid it. And that
yes,
that was very much sold as a way to do it. So they were actually eating to catch up with their medication. That it
which
was a
is
very
so
weird,
backwards.
yeah, a very weird way of doing this. But it was about that time that insulin resistance started to be talked about. And this was a
Mm,
completely different way of thinking about it because now we're not saying that everyone's pancreas is just declining and not making enough insulin. We're saying actually that people, to compensate, because your body is always very clever about trying
mm,
to right things, that in order to right things, it was producing more insulin to deal with these huge sugar spikes, but
yeah.
in doing so, it was desensitizing the cells to insulin. And once we started to get a little bit of understanding, it started
From
to
there, it started to
fall into
change.
place.
Okay, so let's be honest, we did all the wrong things. We didn't
Yeah,
understand the disease to the
yeah,
extent that we understand it now. So, what made the real change for you personally? How did the light bulb come on and you think, oh, hang on?
right. So this, was a sort of slow process in that I took note about a few things. A lot of my patients were overweight. They were really distressed by the treatment we were giving them and making
Mm,
them more overweight. They were very distressed by hyperglycemia. And
mm.
I've always said patients are the best teachers
Oh,
if you
definitely.
listen to them. And at
Yeah.
about this time, I had a woman uh, who had had diabetes for a few years, and she had been online, and there was quite a lot of online information at the time, just beginning about using
Yeah.
low carbohydrate diets to address the problem and resensitizing this whole system. Um, and she just changed her diet, took it into
Mm.
her own hands, and came back for an annual review, having stopped her medications.
Amazing.
And I
Not
was
that
so
just wait, hang on one second. Not that we are advocating that people just
no,
stop
no,
their
no, no, we're
medications.
not. No, but she had to stop them because her sugars were going too low.
Yeah,
And I think, and she basically, when we did her blood test, she'd reversed her diabetes. I'd never seen that before. I never even knew it was possible. And I was
yeah,
incredibly excited. So this was about then that this sort of
yeah.
started.
See, this is fascinating because when I was at university in my final year, and I'm not going to tell
Yeah.
you where that was, but it was
No,
prior to this patient,
a lot
we,
after me. Yeah.
yes, all right.
Yeah.
But we were told reversing diabetes is possible. Reversing type 2 diabetes is possible. People are starting to do this. People are starting to be aware of this now.
Okay. So it was out
Imagine
there.
my imagine my
Yeah.
surprise, however, when I actually got into practice and realized no one was doing it. And that
No.
was really quite upsetting because I thought, well, we know we can do this. Why aren't we doing it?
Mm,
So then it took a few years to get into sort of general consciousness. Then you got patients like this, and there was more information out for them to do their own work, I
yeah.
suppose, and their own
Yeah.
thinking. Um,
Yeah.
and then gradually, I think we had some changes and things became a bit more mainstream.
Although, it has been incredibly slow, I think.
Mm,
And at the
mm.
time, remember, they were still talking, all the dietary guidelines were all about low fat, low
Oh,
saturated
yeah,
fats. So people were basing their meals around carbohydrates. And
yeah.
this didn't make any sense, not to them or to me. But I have to say, it was very slow. And I'm not actually completely convinced we still
Haven't
getting
cracked
this
it.
right in practice. But of course, I haven't been a clinician for quite a few years now.
I think what's
Um,
interesting is that we know we've talked about the low fat and where it came from and stuff, but the
yeah,
legacy of that message
yes, yes,
has
yes, yes.
been so long and unnecessary, hasn't it? I think it's such a shame.
About this time, I walked in to buy lunch in my local supermarket in the days that I bought lunch and didn't take it.
Yep.
That's
We've
another
all been there.
story. Yeah. But I saw a headline on a newspaper about a professor in Newcastle, a researcher, who had
Hmm.
done a very small study. There were 15 participants using low carb, restricted calorie diets to reverse type 2 diabetes. And I mean, this was tiny, but the fact was, I could not believe my eyes. I thought, this is it. This gives me credence to do this. Because I think if you're not doing what everyone else is doing in health, it always feels tricky. Like,
Yes.
could
Yeah.
you
Should we be
be
doing this? Could we be at
liable
risk?
for, yeah, exactly.
Yeah.
Anyway, this was Professor Taylor, and I think his work really started to change things
Yeah. I
in
mean,
clinical circles.
he is still widely recognized as the
Yeah,
person that made the changes that were possible for people to think that actually we could do this, and it lives on. We're
it does.
we're still
Yeah,
using his work to this day.
and his
Um,
work's still going on. Actually, he did a
his
much bigger
trials,
study.
yeah,
Yeah, after that, called the direct study, and I think the interim that we're still on interim results, but they have been pretty life changing. As
mm,
in, as good or better than medication in terms of getting results about
yeah,
managing blood sugars, which doesn't make sense really not to do this.
no,
And
and I
at
think
about that time, guess who else popped up? Um, the late Dr. Michael Mosley did a program on TV, and I remember seeing it again, a real excitement for me, and
yeah,
also wrote a book called The Blood Sugar Diet.
yeah.
Um,
I remember reading that and when that came out, and that started, I think, quite a lot of the sort of what I would say now the movement of metabolic health
yeah.
and the understanding. I mean, there's a broad spectrum to metabolic health, let's be honest.
Oh,
We all
huge. Yeah,
need
this is
good
only one
metabolic
bit of
health,
it.
but
Yeah.
this is I think this is where it started and it's almost the most exciting part because actually if you can reverse somebody's type 2 diabetes, I mean
Oh,
that's
I mean,
incredible. That's just
and so,
astonishing.
and such a different, it became a really exciting area to work in. That was the difference.
Yeah, so suddenly
Um,
you enjoyed your job.
exactly. I enjoyed it so much that in the end, I only did this bit of my job. I mean, that's how
Yeah.
much I enjoyed it. It was honestly the highest of highs to
Mm.
help somebody to to reverse their diabetes. Honestly, it was just mind blowing. So we started to understand about insulin resistance, about hunger, about weight gain, about why medications weren't necessarily the answer, and that changing people's food intake and activity levels really did make a difference.
Mm.
We also realized at the time there was cortisol levels, and that was to do with chronic stress and lack of sleep and other things that were also affecting people's blood sugars. So all of this started to be sort of known. I can't believe how exciting it was.
Mm.
Um, and we started to give patients hope. And I do think of all the things, that was the thing that was most transformative. We gave
Mm.
them hope and we said, none of this is your fault. And we're going to empower you to really take charge of your health, but you're going to have to do the work. But
Mm.
you really can. Not everybody can reverse their type 2 diabetes, but
But
quite a
they
big
can make
proportion
huge
of people
improvements.
can.
Mm.
And also, we started to get better, remember, at diagnosing things earlier. So that's another story. But before, remember, we'd almost waited for the complications to get the diagnosis. Now we were testing people who were overweight, for instance, or had other metabolic syndrome issues like high blood
Yeah.
pressures. They were beginning to get tested. And the HbA1c test, which was a much, much easier test,
Yes.
than just fasting blood sugars because it looked back over 12 weeks and gave you a mean of blood sugars. So this changed everything as well because diagnosis became an awful lot
Not easier.
easier and more
Mm.
standard.
Mm.
It was
Amazing.
it was a golden time to be a nurse looking after diabetics. I honestly believe that it was transformational for me personally too. I used meters, which blood sugar meters, which I got from pharmaceutical companies. We
Yeah.
used food diaries. We started really getting great feedback for people. So there's nothing like seeing your own blood sugar shoot up when you have cereal, toast, and marmalade to
Yes.
understand that maybe the nurse was onto something and maybe this was worth having a go at.
Yeah.
And weight management too, because it's really depressing not to be able to manage your weight. A lot of my
Well,
patients were
especially
very keen,
yeah,
you
and
know.
especially if it's not your fault and the reason that you've put on weight is because somebody's given you a
Yes.
medication. I mean, I
Yeah.
think that's I mean,
Mm.
medication, is amazing, and I'm always loath to throw the baby out with the bathwater because, I wouldn't
Mm.
certainly be alive without some medications. But
Absolutely.
at the same time, the side effects of the medication were making their disease worse, and there is nothing more depressing than that.
No, it really was. And to be fair to them, the many of them had become overweight because of the metabolic problem a long time before that. So a lot of these patients are they often had, by the way, family histories of type 2 diabetes, and they were
Yeah.
probably susceptible genetically, but the weight increase came a long time, often before diagnosis. So they were those sort of people who said, I just look at food and I put on weight. Don't know
Yes.
why. I can't seem to lose it. And I
Yeah.
think as a medical profession, we just thought, well, they're obviously eating too much and they don't move enough. There was
Yeah.
a
And there was that, and
patronizing
at that
sort of,
time, it was
yeah,
literally like you are you're eating too much and you're not moving enough, and we didn't understand all the other
no.
things that we now understand about how to lose weight and how to maintain your healthy weight, and it all goes hand in hand.
So
Fascinating.
when you had a newly diagnosed patient with type 2 diabetes, it was a real golden opportunity to say some of this and lots of this and most of this is not your fault. I'm going to explain it all to you, and
Mm,
I've got some fabulous news for you. We
yeah, and
really
how
can improve this.
absolutely, and how freeing and how
Yes. Oh
releasing it is
yes.
for that patient to be told, actually,
Yes.
this is not your fault. We can work
No.
together. There is hope here. And I think that maybe is the best news ever.
Oh,
There
it
is
was
hope.
it was so exciting to do it with him. I felt like I'd discovered some amazing treasure. I always
Mm,
said, "Look, give me 3 months, and you and I are going to do something really great. And when we repeat your bloods in 3 months' time,
you'll be
we're
so
going to
amazed.
make your GP really smile because we are going to make this so much better. I mean, you don't
Mm.
guarantee people. And there was a lot of talk at the time about reversing versus, it's not curative, it's
Remission.
remission. And
Yeah,
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 but it
but
doesn't
even
really
so,
matter.
it
Yeah, it
doesn't
doesn't
really
really
matter,
matter.
does it?
No.
If you're
And
if you're preventing these nasty side effects of
yes, the
diabetes,
complications were huge. And
yeah,
remember, we used the complications initially
to beat
almost as
people over the head with.
a fear, a sort of scaremongering thing of saying, if you don't comply, this is what's going to happen to you. I
Yeah.
remember actually showing people pictures. I cringe now of
Mm.
diabetic ulcers on feet. And by the way, people were often diagnosed that way. So they would come in
Yes.
with an ulcer that didn't heal, and someone would think, oh, maybe I'll do their sugars, or awful thrush, or whatever the sort of.
Mm.
Anyway,
Mm.
the rest is history, as they say. I went on to change my whole career. And I'm so lucky because I'm
Because you
now
get
all
to work
about
with me.
health. Yeah, I do get to work with you, but it's all about health and not
Yeah.
just disease management. And I suppose for me, I sort of wished I'd done it earlier, but I didn't. But I was sort of
Yeah.
lucky. I was lucky to be in the right place at the right time and have enough curiosity, maybe. And also, as a nurse, I sort of felt like I had more time to actually listen to patients. I
Mm.
worked in very busy general practices. They're all very busy. And I probably had slightly more time to
Mm.
sit down and think what actually goes on here. So
Fabulous.
I'm forever grateful.
Mm.
That's my story.
Brilliant. Thank you very much. I think that's a great story. And I think, mine's quite similar, but I just didn't
Yeah.
do the stuff at the same
From a
time as
slightly
you
different angle. Yeah.
and from a slightly different angle. But isn't it fabulous now that, we're together and we're looking at this and saying, well,
Yes.
we can really help you.
You were
Um,
the medication person, to
I
be fair,
was.
in the puzzle.
Yeah.
So, I mean, how
It always
fantastic to
made
have
me
made
so
that.
sad, the people that
Yeah,
couldn't tolerate the metformin, because I knew that
yeah,
actually, if they
yeah.
weren't going to
Things were
take
going to
that,
get
what they
worse.
were going to take, it wasn't going to be good. No, it always made me
Yeah,
really
I mean there
sad.
are there are more current medications that are much more sophisticated than the ones we started with. So not all
Yes, of course.
medications for diabetes are primitive
As
by any manner of means, and there's some very
yeah, yeah.
sophisticated ones, of course. So let's not decry any of that. And
Time has moved on. We're talking about
yeah, and some
a
people need
decade,
medication.
15 years ago.
There's still complications out there. So
Mm.
it's not all. We watched a program recently, didn't we, about complications of
Yes.
diabetes, TV program. We were quite shocked. And you do wonder how much people know about the sort of options when it comes to treating diabetes.
Mm.
Anyway, that is my story. And we'll talk about another interesting bit on another podcast about pre-diabetes, which is
Yes.
a whole other story.
Whole other story. Yes, but I'm really looking forward to getting into that one. Okay,
Okay.
cool. We'll see you next time.
See you soon. Bye for
Bye.
now.